I'm Lynn Cagle, Chief Nursing Officer here at Parkwest Medical Center. Thank you for attending this hourly Rounding with a Purpose class. It's no secret that we are in the midst of a new kind of health care, and meeting the needs of our patients is paramount to our success. It's also no secret that our workloads have become more challenging than ever. Providing you with tools and techniques to successfully meet those challenges is a priority of our organization. Hourly Rounding with a Purpose is an evidence-based tool to increase patient satisfaction while helping you work smarter, not harder. It provides patients the understanding that we will check on them routinely while returning time to the staff by reducing the call lights and requests. Hourly Rounding with a Purpose will be incorporated into our culture here at Parkwest with as much emphasis as bedside shift report, AIDET, and the use of care boards. Today you will receive training and any questions you have will be answered. Moving forward, the utilization of this tool will be audited by nursing leadership for compliance and consistency. You will be coached, assisted, and held accountable as rounding will become part of our daily routine. With repetition, you will become more comfortable with rounding. You will find that your patient's needs are being met proactively instead of reactively. Your day will become more organized and your steps fewer. Please know that you will be supported in this endeavor, and we as a facility will truly be committed to hourly rounding with a purpose. It is what's right for our patients. Thank you for your time and dedication in making Parkwest the hospital of choice.
Hey David, hey Elena, how's your day going?
It's been wild. These patients have kept me hopping. I get one patient medicated, then another calls out. I just can't seem to keep up today.
Tell me about it. Those call-outs have this hallway lit up like the Vegas Strip. I'm exhausted. And it's not even lunch yet.
Listen, I know exactly what you're talking about. I've been there myself. But what if I told you that there's a way you can get control of not only your day, but more importantly, these call lights?
I'd say fill me in quickly before another one goes off.
It's called Hourly Rounding with a Purpose, and here's how it works. Each day needs to begin with a bedside report. Use your SBAR format as a guide. Make sure to encourage patient participation during this time. After all, this is about the patient. This is also a good time to introduce oncoming staff and manage them up to the patient. First, reintroduce yourself using the AIDET method. That stands for Acknowledge, Introduce, Duration, Explanation, and Thank You. It is important to always begin the day by utilizing your patient care board.
I'm back, Miss Smith. My name is Joy again, and I'm going to be taking care of you today. I've been a nurse here for over 5 years, and I want to take a few minutes to go over your plan of care and your care board so you'll know what to expect.
Okay, Ms. Smith, I see that your physician today is Dr. Robinson. He's been a physician here for several years. You're going to love him. And let's see, we want you up with 1 assist, so make sure you use your call light because we don't want you to fall. Oh, great. You didn't need any pain medication last night, so that's good. That tells us we're managing your pain. And as far as your goals today, we want you in the chair, out of bed for all your meals. We want you to use your incentive spirometer, I'd say about 3 or 4 times an hour. We want to keep those lungs nice and open. Don't want you to get any more complications. And walk in the hallway with me or Elena at least twice. And let's see, that looks good. So we're going to work together to make sure you accomplish all those goals today. I also need to let you know that either myself or your CNA, Elena, will be checking on you about every hour. We want to make sure that everything is fine and that we're meeting your needs. And we'll be asking you a series of short questions just to check on you and make sure that your needs are being met. We'll be checking on things like your pain. We want to make sure that you're as comfortable as possible, and we're doing everything to manage that safely. We'll check to see that you're in a comfortable position, either if you're in the bed or in the chair. We'll also check to make sure that you have all your possessions close by so that you can get to them. We're going to check to see if you need to go to the bathroom, and at that time we'll be happy to assist you. Okay, and one other thing, I'm going to be checking those pumps to make sure that your pump is running smoothly so that these alarms won't be going off. Okay, so let's give this a try. Are you having any pain or discomfort right now?
Not a bit.
Can I assist you to the bathroom?
No, a CNA was in just a few minutes ago and was nice enough to help me in there.
Okay, great. Are you comfortable in your current position?
This pillow, something seems to be wrong.
Okay,
it's
dear,
going the wrong way.
Let's pull it over this way a little bit. Okay.
Thank
How's
you
that?
very much, honey.
Okay. And let's see, do you have everything that you need within your reach? We've got your call light, your incentive spirometer, your water.
Yes, I believe we do.
Okay, your IV bag is full. Your bed alarms are turned on and engaged. Is there anything else you need, Mrs.
I
Smith?
don't need a thing, honey. I just appreciate you so much.
Okay, are you sure I have the time? I don't mind.
I know that, but you have other things to do. You just come back around sometime when you've got a few minutes.
Okay, Miss Smith. I'll be back in about an hour.
Okay,
Thank
thank you.
That all sounds great, Joy. But doesn't it just add to our workload already?
Well, look at it this way, Elena. You're going to have to go in your patient's room each time they call out anyway, right? So would you rather make several trips for every single need or take care of everything at one time? That's what hourly rounding with a purpose is about. Using the 5 Ps to help nursing staff work smarter, not harder. It gives them a sense of reassurance. And it saves some wear and tear on yourself and these Danscos.
The 5 Ps, huh? That's amazing how something so simple can have such an impact on you and your patient.
Impact is right, David. Hospital rounding with a purpose has been proven to increase both patient and employee satisfaction. As a matter of fact, hospitals who've hardwired hourly rounding with a purpose, they've been known to decrease the level of patient falls, the level of hospital-acquired pressure ulcers, and even increase the level of pain control in their patients, not to mention controlling these call lights. So, what are you thinking? You willing to give it a try? So let's get out there and round with a purpose. Bedside report.
Mrs. Smith, this is Joy. She's going to be the RN taking excellent care of you today, okay?
AIDET.
Good morning, Miss Smith. My name is Elena, and I'm going to be your CNA today.
Care boards.
Let's talk about your goals for the day.
Hourly rounding with a purpose. Pain.
Are you having any pain?
POTTY.
Do you need to go to the bathroom, Mrs. Smith? I have the time.
Position.
Are you comfortable in that position?
Possessions.
We want to make sure everything is within your reach. Is there anything you need?
Pumps.
I'm going to check your IV pump for you. Okay, Mrs. Smith, I'll be back in about an hour.